Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 069. A 9-month-old infant presents with delayed tooth eruption and fontanel closure, weakness, and excessive sweating. What type of hypovitaminosis is the most likely in this child? A. Hypovitaminosis B6. B. Hypovitaminosis B1. C. Hypovitaminosis A. D. Hypovitaminosis circa. E. Hypovitaminosis D. Hypovitaminosis D is an insufficiency or deficiency of vitamin D that can affect people across the lifespan. Vitamin D is a fat-soluble vitamin that affects mineral metabolism and numerous other physiologic functions. Risk factors: people over the age of 65 years. Skin's ability to make vitamin D decreases with age. People who are homebound. Less chance for sun exposure. Dark-colored skin. More difficult to make vitamin D from sunlight than light-colored skin. Symptoms: hypocalcemia, falls and fractures, osteoporosis, dental concerns, e.g. periodontal disease, dental caries, tooth loss, particularly for children, arrhythmias, kidney problems, mental health issues, e.g. fatigue, depression, impaired cognitive function. Hypophosphatemia, rickets, softening of bones during childhood. Osteomalacia, softening of bones in adults. Neuromusculoskeletal illness, hyperparathyroidism, diabetes, blood clots, autoimmune diseases. Inflammation, malignancies. The mental health issues may arise from hypocalcemia in the brain, where calcium is critical for proper nerve cell function. Parathyroid hormone helps the body manage the calcium levels it needs. Hyperparathyroidism is where the parathyroid glands produce too much parathyroid hormone. It can cause the blood calcium levels too high, hypercalcemia. Vitamin D has anti-inflammatory properties. It contributes to reduction in pro-inflammatory mediators and an increase in anti-inflammatory cytokines. It can decrease C-reactive protein, CRP. The main mechanisms involved in the obesity-related hypovitaminosis D include decreased bioavailability of vitamin D due to its fat solubility and sequestration in abdominal fat, reduced intestinal absorption, impaired metabolism, decreased liver 25-O-D synthesis as a result of hepatic steatosis, and the influence of leptin and interleukin-6, IL-6, on hepatic vitamin D receptors, VDRS. There is also some evidence that inflammation could reduce 25-O-D levels via oxidative stress, resulting in the oxidative 25-O-D catabolism. Sedentary lifestyle and lower outdoor physical activity, leading to insufficient sun exposure as well as inappropriate vitamin D dietary intake, also predispose obese individuals to vitamin D deficiency. Leptin is secreted mainly by white adipose tissue, and levels are positively correlated with the amount of body fat. Like many other hormones, it is secreted in a pulsatile fashion and has a significant diurnal variation with higher levels in the evening and early morning hours. The circulating leptin level serves as a gauge for energy reserves and directs the central nervous system to adjust food intake and energy expenditure accordingly. It exerts immediate effects by acting on the brain to regulate appetite. The answer is E. Hypovitaminosis D.